Good evening, everyone on the Viva Learning platform. It's a great pleasure to be with you guys over the next hour. That's going to come and share with you some of my experiences, personal and professional, on this topic that has been debated to death over the past few years in endodontic therapy, and it's a topic of reciprocation motion versus rotation motion. Of course, this is merely the motion of a rotary instrument during the root canal shaping process, which comes before obturation. But let's not lose sight that proper diagnosis and treatment planning, good straight line access, good irrigation and debris management, and obviously finally that obturation and the ensuing restoration are equally, if not more important than just the mere shaping process for developing and delivering successful outcomes to our patients. But for reasons that I will mention in a couple of minutes here, this area of instrument motion is also very important because it helps us achieve our goal of shaping, which is designed to accommodate our obturation, as well as cleaning and removing the biofilm based on a set of priorities. So during tonight's presentation, what I'm hoping to do is to address a common question that I'm asked regularly by you guys online, and that's the question of which instrument motion is better in order to shape the root canal. Is it the traditional rotation motion, which was the first that came on the market, or is it the more recently introduced asymmetrical reciprocation motion? Of course, whenever I'm asked that question, I usually qualify the answer by asking another question of, what do we mean here by the word better? I mean, what is better? Do we mean a higher success rate? Do we mean a faster instrumentation time? A safer motion for instrumentation, which would mean less torque on the dentinal walls during shaping, or also less torque on the file, which translates into less file separation and breakage? So, or even, cheaper files. I mean, all of these are factors that are important to us clinically and help us make a decision about what system we should use. Now, all of these things are good and important, but unfortunately, today, there's no one instrument or system that can give us everything we want to have the maximum efficiency, the maximum safety, the maximum reduction of the torque with the least number of instruments at the cheapest price. That'd be awesome, right? But of course, in a sense, that might be a good thing, because if it was such thing was present, it would be done by robots, and we would be our jobs would be obsolete like many other sectors of the economy. So the fact of the matter here is, despite these limitations, there are many ways to skin the cat, as the expression says, right? So we can achieve shaping in many different ways, but we have to set at least some priorities about what really matters to us most during our shaping process so that we can achieve our goal the way we want. And our goal, or at least my goal and my educational platform's goal here, is to make things as simple as possible. I love this quote by Albert Einstein, that things should be made as simple as possible, but not simpler. My own program director, Takachi, used to always say things should be simple, but not simplistic. And that really is a key thing that I want us to keep in mind, because ultimately what we're trying to achieve, despite all of these little complexities, is to achieve successful outcomes for our patients. And for me personally, after having now completed, anywhere from 20 to 25,000 documented cases of endodontic therapy, I've kind of defined it very simply as happy and healthy patients. So based on this definition and my interest in reducing the complexity of the process of shaping, so let me just begin by saying that whether you're using reciprocation or rotation, there's really no significant change in your success rate, because that's a significant thing to keep in mind, because you should really have an equally high or equally low success rate unless you can effectively address the root canal biofilm during the procedure. So it's not the motion of the instrument that is really going to address this issue for us. It is really a function of finding all of the root canals, which means you have to have a good access, and then you have to have proper techniques to get down these canals so that you can remove the tissue that's in there. And you have to have methods and techniques that doesn't pack debris, and that it allows, with good irrigation and macro debris removal, remove the biofilm that's in there so that you can achieve proper obturation. So one important key during this process is biofilm debris management, which helps us in preventing the packing of the biofilm laterally and apically during the shaping, which causes canal obstruction or extrusion of the biofilm and the materials past the apex, which is not a good thing because that causes postoperative pain for our patients. So these are factors that we need to keep in mind. And over the past 25 years of my career, having seen NiTi instruments being introduced right at the beginning of my career, and in fact, our program at Harvard was the first to embrace NiTi rotary instruments into the postdoctoral program. So we got trained right from the get-go with these NiTi files at their inception, and over the ensuing 25 years, I've seen the huge evolution in the design, metallurgy, motions, the way we use these instruments, with the ultimate goal of developing a shape that we can then obturate in order to to get the results that we want. And that really has led to this concept that was developed by our educational platform here, Vivo, which was if we end up having a constant tapered preparation, or a preparation that we can mill with a master file, then we can have a matching paper point and gutta percha, and then later on even a matching post to the file that could follow through. And this is a concept we call synchronicity, which means that at the end of the day, really our goal here is to create a shape, a reproducible shape that is, from there on, we can follow with our obturation to the end. And that really is the essence of instrumentation. And over the years, we've seen this, this whole concept evolve with different designs and metallurgy. And basically what we started this whole process with were the landed files. When I was a resident, the profile, which was the first file, came out on the market, and this file was a landed file, which means if you get the cursor here, these areas, these flat areas of the file in cross-section inside a round canal would be touching the walls, and this would help create a centering mechanism. So during the cutting motion, this file would be, centered, and it gave us a lot of control. However, what happened is because it was flat, it created a lot of torque and a lot of resistance, and it burnished the dentin instead of cutting it, so it was not efficient at all. So the next generation were the non-landed files, and the first one was the endosequence file, and then also the ProTaper file were instruments that where the land area was removed. And by the removal of the land area, we ended up having instruments that could be very, very efficient. So what we gained in efficiency, however, was a loss in control, because if you kept one of these files rotating in the canal for any extensive period of time, you would end up getting a little bit of transportation, because these things could cut pretty efficiently. So we also had to learn that a concept of what I call engagement time, which means that whenever you're cutting dentin, you shouldn't be staying in touch with the dentinal walls too long. So your contact time or engagement time should be as little as possible. All of these are building towards a motion that I'm going to explain to you that will help in terms of addressing some of these issues. So a little bit later, this modified lens came about, which was kind of somewhere in between landed and non-landed files. And their main goal here was so we can get a little bit of control as well as have some efficiency. And these are, this is the Hero design that you can find in the newly released endosequence Scout files. And these are great for apical control, so that especially when you combine these with heat-treated instruments, these are great files to use in the apical half of the root canal, so that you can have some control and efficiency and work the file down to the apex in a very safe way. Of course, at this point, there was a little dichotomy in terms of motion itself, not so much instrument design. All of these were working in rotational design. But then suddenly the idea came that, well, part of the problem with rotation is it creates a lot of debris, and people don't do the correct job of reducing their engagement time. They stay in the canal too long. So some manufacturers came and said, well, what can we do this asymmetrical motion, which is basically cutting and releasing, and the main goal of this motion was to actually have more safety. So from these set of different instruments and designs and motions of rotation and reciprocation, we really had to make a choice here between safety and efficiency. Efficiency, without a doubt, any rotational motion is far more efficient than any asymmetrical reciprocation motion. Question about that. Because the cutting is far more efficient during pure rotation. And if we have someone who's experienced and who has knowledge and understands these concepts of engagement time, then in their hands, the efficiency is combined with safety. But for those people that may not quite understand the concept of engagement time, the reciprocation motion would give them a lot more safety. And that was really the crux of the issue, that the argument for reciprocation versus rotation really was an argument for people who prioritize on having a safer instrumentation technique versus rotation, which really focused on efficiency. Of course, as I mentioned before, it doesn't mean rotation cannot be safe. However, in order to make rotation safe, you really need to pay attention to a few different things, which we're going to talk about, and how you can make rotation a little bit safer as well. But if you look at this little seesaw effect, there is this set of priorities at the two ends of motion between rotation, pure rotation, which has higher efficiency but at a potentially lower safety if you don't know what you're doing, versus asymmetrical reciprocation, which cuts down the efficiency in the hope of giving you a little bit more safety, making it a little bit more foolproof. So but this idea of reciprocation here is really requires us to understand some of the other downsides. I mean, we would think because, well, wait a minute, the efficiency, a loss of efficiency may not be as big a deal to many people, but there are other problems that are specifically a function of reciprocation, and more precisely, the modern version of the reciprocation, which is a single file reciprocation. And those problems are the problems of debris extrusion, because when you try to force one big file to the end of the root, you create a lot of debris that moves ahead of the file, and the file can potentially push that laterally as well as apically, and that could cause some issues with post-op pain as a result of this biofilm extrusion. Also, when you try to jam a big file down to the apex, you end up also over-torquing the dentin as well as the file. So the main difference here is that when we talk about reciprocation, we really should be talking about two separate flavors of reciprocation. One is the more recently touted single file reciprocation, and then there is also this lesser known alternative, which is the use of reciprocation motion with more than a single file. Essentially cutting down the motion of cutting and divvying it up between more than a single file, using 2 to 3 files, and in the process have certain advantages that a single file doesn't have. The problem with the single file is that as you try to jam a big, thick final master file into a thin canal, you are pushing too much debris out laterally, which not only torques the file itself, but also puts torque on the dentinal walls. So if you don't have to go far, in fact, if you can just look at the Handyman magazine's cover page, you will see that carpenters and construction workers have known for years that if you want to put in a thicker screw into drywall, what you need to do is you need to pre-tap it. And by pre-tapping it, what you're doing is you're essentially you're divvying up, as I mentioned, the cutting process. Otherwise, if you try to jam a very thick screw into drywall, all the debris is going to get packed laterally, which is going to create these little micro cracks. Of course, it's not the case in the drywall, but in our case, where we're talking about a tube, which is the root canal, the debris doesn't just get packed laterally, it will also get packed apically. As the file gets closer to the apex, it could potentially get pushed out. So that is one major problem, and we're going to have to see how we can potentially address that issue. So what we're doing in the process of shaping is we're trying to go from this thin canal to a final shape. Essentially, the diameter of the root canals does not follow the diameter of our files, which have been traditionally been 04, 02, 04, and 06s. But the diameter of a natural canal is probably more like an 0.1, if you will. It's much thinner in taper. As a result, whenever we put files in the canal, it ends up binding more coronally than it does apically. So when you put a size 10 hand file in the canal and it binds, you would think that it's binding at the tip of the instrument, but in fact, it is binding more up on top. So that is really the essence of the crown down technique, because it helps remove, it does some coronal flaring that opens up the canal to allow the file to move further down. So when we're trying to go from a thinner shape to a thicker shape, if we're using a single file versus the multiple file, as you can see here, in a single file, we are jamming one thick file into the canal, which means the equivalent of all that red that you see is the debris that would have had to be removed in order to create that shape in the root canal, and that ends up getting pushed laterally as well as apically, potentially. However, when we do this with using multiple files, whether 2 or 3 files in the process of reciprocation, so not a single reciprocation file, but 2 to 3 reciprocation files for a given thin canal, then what we're doing is we are distributing the cutting among several files. So each file in the process of a crown down is removing less debris, and that helps reduce the torque both on the file as well as on the dentinal walls, and gets away with some of the problems that we end up seeing. Because this is what happens during reciprocation motion, is that especially in oval canals, the debris that is cut gets packed laterally. So it's important to minimize the cutting time inside the root canal, because if we stay too long, then we would end up packing this debris in the canal too long. So another thing is that what we need to do is we need to not stay in the root canal too long during our motions, which means we have to reduce the number of strokes we take before we take the file out, irrigate, and wipe the flutes clean. Let me also mention this issue of crown down technique and its difference. In a crown down technique, if you want to achieve this type of incremental cutting using multiple files, in a crown down technique, the best way you can do that to reduce post-op or rather extrusion of the debris is, well, it looks like the animation here did not work. All right, so it seems like the this animation has not loaded up. But basically what this animation is going to show to you is that the larger size file is used first, but the goal is not to push it to the apex. The goal is to push it with just a few strokes so it can move down the canal. Then you use one smaller size file so that it cuts also a few strokes down the canal, and then you use one smaller size file. The difference between crown down technique and the step back technique is people who use the step back technique try to rush to the apex, get to the apex, get the working length, and then increase that diameter apically. The crown down technique says do some coronal flaring and then use decreasing size files so that each file advances a little bit more than the previous file, until by the time you reach the apex, you've already removed all of that debris up on the top. The advantage of that is exactly what I said. You've removed all the filthy biofilm, full of biofilm debris up coronally before you reach the apex, so that your odds of pushing debris apically are reduced in that way. So single file reciprocation, because you're jamming a single file down to the apex, could potentially push more debris out apically, rather than using multiple files in a crown down technique, which will remove the debris before you get down. So that's a big advantage. Other thing that I want to kind of bring to your attention is the concept of motion as a whole, which isn't just the function of rotation versus reciprocation, but a division in terms of how we define motion between the device motion and the operator motion. Traditionally, the device motion has been originally rotation, and then later on the manufacturers added control to the hand pieces so that if the file was getting over torqued, then it would reverse back. Then that type of torque control became optimized, known as the OTR, which was optimized torque reduction, which meant that the rotation wouldn't be fully interrupted. It would simply just go back a little bit and continue. And then finally this asymmetrical reciprocation motion came about to kind of help reduce debris loading on the file and the torque on the file. But the other thing that has not really been adequately explained to users is the operator motion. I mean, when I was a resident and they gave us a handpiece, and it was an air-driven handpiece at the time that had, that had a range 300 to 600 RPM, they were like, here's a handpiece, use it. Nobody really had any concept of how to use a handpiece for the specific motion and for the specific purpose properly. So people used the continuous push to resistance, which was a huge problem because it created the early phase of rotary night-eye instrumentation has been riddled with separated instruments because we were using these handpieces and our files like Black & Decker drills, and that was causing a lot of problems. And then we were later told to have this push and pull or pecking motion, which also turned out to be very difficult to describe or standardize so that everybody does the same thing. And we at Real Dendo were the first to kind of recognize this problem of a lack of standardization between motion, the described operator motion. After doing thousands of hands-on courses, but we realized that you can give a same handpiece, the same block, and the same file to two different operators, and you end up getting completely different results. And the reason for that is because the motion were not adequately explained. So Dr. Scotch and Bray first described this motion called the rhythm motion, which was 3 light strokes to engagement, followed by removal of the file, and then cleaning the debris from the file, which is a significant and important point, as I will explain in a second, and then irrigating, and then continuing with another rhythm motion as needed. Later on in 2013, I also described another motion called single stroke and clean, or SSC, and this motion meant that you only take a single stroke to engagement and remove the file and wipe it clean. The purpose of this was so that you would reduce the amount of torque on the file. And this was really inspired by the concept of this analogy of if you were told to move sugar from one bowl to an empty one using a spoon, you would do a natural kind of motion of taking a spoonful and then taking it to the other empty bowl and emptying it. And then you would continue this process with one stroke of the spoon until the debris was transferred. However, what we were taught up until that we would take one motion and then have the spoon full, and then we would take additional motions. Our spoon was not getting full, but all the debris was getting released back into the root canal. So this idea became ever more clear that what we need to do is we need to use our files like spoons, which means that we need to clean them of debris. And that was some kind of a revelation in a sense that we were not doing that until then. Everybody was more concerned with irrigating inside the root canal as opposed to completely thinking of our files like little spoons that go inside the canal. They take one core sample, you remove it, and then the debris that's on the file is actually the debris that was in the canal. So your file is like a spoon removing one tiny layer of dentin as it's working its way down. So this was very important, but what we found with the SSC motion was that despite the fact that this motion has the least amount of torque on the file and on the dentin, that people were getting lazy and they weren't properly using it as a single stroke and clean. So we found that the rhythm motion, which was 3 strokes to engagement, was something that everybody could agree that it wasn't, really decreasing their efficiency, that you have to take a single stroke and remove it and wipe it. Just stick to the rhythm motion, which is 3 light strokes, and it's basically this. Take 3 light strokes with this is an operator motion, with your hand controlling the handpiece. Whether you're doing rotation or reciprocation, you're still using this rhythm motion, and this reduces the engagement time. And as you can see here, that basically is a little bit of engagement time, and then you're removing it and you use this endo swipe to wipe the flutes of the file. So to also look at it from this graphics point of view, what we're doing, if the vertical line is the root canal. There's 2 points along this line, which is the engagement, which is the first time that the file begins to engage dentin and starts to cut it. And then there is this point called resist, which is a little bit further down the canal. And that's the time between the first point to the other point is the time it takes for the chip space of the file to get full, or if you will, for the spoon to get full. So the goal is to really do your motion, take 3 strokes, light strokes, and never really get to the full resistance point. Just the engagement, 3 light strokes to engagement. And there it is. And then you remove the file and you wipe it clean. And that was really the essence of this rhythm technique. Another concept that I want you to keep in mind is the idea of where you should be holding the handpiece in your hand. If you hold the handpiece too close to the tip while you're doing your rhythm motion or even SSC, you tend to concentrate the force too much, and people tend to push too far apically. So my recommendation is that you hold the handpiece a little bit farther out from the tip, because what that does is it helps reduce, it increases the lever arm, and it reduces the amount of pressure that you would put on the tip of the handpiece. So, you know, less apical pressure is what's needed. Now, what I want to do is just focus more on the reciprocation motion and these instruments, the new instruments, of how we could optimize our knowledge of these things that I mentioned in terms of the motion, in terms of the number of strokes, in terms of the crown down, and in terms of using more than just a single file. How can we use this information to go back to the drawing board and come up with a technique that is hopefully a little bit better than the current single file reciprocation techniques that are out there, so that we can get both safety as well as simplicity for our results. So reciprocation motion is the same reciprocation motion that has been described in the literature, asymmetrical reciprocation motion, which can range anywhere from 150 to 170 in a counterclockwise direction, and then with a clockwise release angle of anywhere from 30 to 50 degrees. So for the most part now, most people are using the 50 to 30 counterclockwise asymmetrical reciprocation motion, which seems to work pretty well. And it's with this idea of using this motion, but then coming up with a different set of files with a different technique, that these new set of files by endosequence reciprocating files, the ESR files, were launched by Brasler USA, which basically is a technique that we at Revolvendo have helped develop to optimize the use of reciprocation motion with these files. These are basically a set of 5 files with which you could do most of your endodontic, address most of your endodontic needs. These range from a size 17, which is the purple tip. This one has, these are all progressive tapers. This first one, which is 17, is called the endosequence reciprocating file, or ESR file, Scout file. And then the size 20, 25, 35, and 45. And we'll talk in a second about the protocol of how to use them, but the goal here is to use these in a crown down fashion. And these instruments come in sterilized packs, pre-packaged, and they are, in terms of design, very similar to the existing Wave 1 Gold files in terms of the parallelogram cross-sectional shape and the heat treatment. The file, the tip, however, is a safety tip, and one other difference in terms of the design is, first of all, I mean, they have a cool little black handle, and they're blue, they're heat treated. One, the progressive in taper. As you can see, the taper is different in the first 3 millimeters and the next 3 millimeters and the next 3 millimeters. It's not a constant taper. But if you compare them with the existing Wave 1 Gold file, which is a very good file, however, these are a little bit less thick up coronally, so they remove a little bit less dentin, because primarily the Wave 1 Gold file is designed so that it works well with the with the obturators, with the thermoplastic obturators. And for that, you need to have a bigger funnel up coronally so that the heat-treated gutta-percha, whether it's gutta-core or thermofill, it doesn't kind of cool down, so you can actually press it and push it down. These files, however, are designed to work with the hydraulic condensation technique using the bioceramic technology, and as a result, that type of removal, excessive removal of dentin up coronally, is not necessary for hydraulic condensation, so that's a little bit of an advantage of preserving a little bit of dentin. Furthermore, one other interesting idea here was, as we know, Wave 1 Gold is a single file use, because after it is used a couple of times, after it's used a single time, the stopper that is in the middle here of the shank kind of expands, and whereas the new file would fit into the handpiece, the sterilized file would not be able to be fit back into the handpiece. And in fact, if you try to remove that stopper and make it fit, that could potentially damage the inside of the handpiece without that stopper. So that's not recommended. So this file is designed to be a single file use. The ESR files, however, we wanted people to be able to reuse them so that they don't, part of the reason people are forced to use a single file reciprocation technique is because of the excessive cost of using it a single time. We wanted to have people have the option to re-sterilize these instruments if needed in some of the easier cases, so that it could help reduce the cost perhaps a little bit. Of course, the manufacturer, Brasler, recommends these to be used as a single use like any of the other files by the manufacturers. But because the protocol that we've designed, we believe, needs to have a couple of files at least, then you at least have that option if you would like to re-sterilize them, that you can re-sterilize these. The other advantage in protocol, and this is actually the protocol for their use, is that you don't need to do a lot of hand instrumentation. For many of the single file reciprocation protocols, what you need to do is you need to enlarge the canal to a much wider diameter in order to get that single file down. Well, for those of you who do hand instrumentation realize that the biggest jump and the biggest hurdle of instrumentation is getting from a size 10 hand file to a size 15, and worse yet, to a size 20 hand file in a thin canal. That's a lot of instrumentation, and that's what causes you to have all those calluses on your fingers. I, having come from a background of getting introduced to NiTi instrumentation very early on, have never been a huge fan of hand instrumentation, and I've tried to reduce the use of hand instruments to the extent possible. And the protocol that we put together for this instrument, the ESR, doesn't require you to increase the diameter of the canal to anything larger than a size 10. However, what you do have to understand is that that size 10 is only acting as a catheter. It's basically catheterizing the canal to make sure you have at least a width of 10 available. And then what you're doing is you're using these in a crown down fashion. So let me explain to you the protocol. So basically you're getting an available length of a hand file, and then you use this primary file, which is you can think of this as the ESR's expediter. The expediter is the file that screens the canal. It triages the canal, kind of gauges the canal to find what should be done with it. So it starts from 10, and it is. Now, the key here is the understanding that no file in the system should be used for more than 1 to 2 rhythm motion. Now, what that means is that, remember, each rhythm motion from our description means that the file is used 3 light strokes to engagement, it's removed, and it's wiped. After 1 to 2 rhythm motions, what you need to do is you need to irrigate. And as I mentioned, you only use each file 1 to 2 rhythm motion. If the file is not at the working length at that point, what you need to do is you need to drop down in size. So you get your estimated working length, you put this file in there, you do 1 or 2 rhythm motions of the 25. If it's not already at the working length, you need to move down in size to a 20. Then you do 1 or 2 rhythm motions of this. If this is not a working length and it's a fairly thin canal, like a mesial-buccal root of a maxillary molar, then you would drop down 1 more in size to a scout, to the ESR scout. And then, as long as this path is present with a size 10, this guy will follow to the apex. Once this follows to the apex, then you move back up to a 20. And if it's a very thin canal, you may want to finish at a 20. Remember, this is not a 20 like a 2002 or a 2004. This is a progressive taper, so it's a much larger canal than actual 2002. If or if you prefer, then you can move up and finish at a 25. So essentially, it turns out that you will end up using 3 files in this technique. The difference here with the single file techniques is they want you to have more hand instrumentation to enlarge the canal, and then basically shove one of the files down to the apex with constant reciprocation motion. And as explained to you before, my problem with that is the fact that you end up putting too much torque both on the file and on the dentinal walls, and you could potentially push debris laterally and apically. So the solution to that is essentially doing this by by distributing the cutting among a couple of files. Most of the time, the 25 and then a 20, and you'll be done. And then if it's a very thin canal, you may need this. So anywhere from 2 to 3 files is what you're going to end up needing in order to complete this case. So if the 25 after 2 motion goes to the apex, however, then you have a large canal, and then you would be moving up in size. And then you would either finish with a 35 or a 45, depending on the canal that you're dealing with. As long as you get clean dentinal chips and you do your irrigation, you'd be fine. And you have matching gutta-percha cones that are bioceramic coated that could be used with hydraulic condensation with this technique. So let's take a quick look now at, so remember, the key point here to remember is that no file is used more than 1 to 2 rhythm motion, unless if it's not, then you move down in size. Okay, so if it's at the apex, then you can move up in size. That is the way it's triaged. This algorithm for getting through cases is the critical component, which you need to understand, which you need to mix with your understanding of the rhythm motion and the crown down concepts. This is the 3 main ingredients of the ESR technique. And I'm just going to show you quickly how this works with the on a block first. As you can see here, a size 10 hand file is used to simply provide a path that we can have. And now we can see that the 25 is several millimeters, like 6 millimeters or so short in this thin block. And you can see here that we're using light rhythm motion, and the debris is accumulated. That debris has to be removed from the file. And after 2 rhythm motions here, it's important that you irrigate. What I prefer to irrigate during this process is with a, you could use EDTA or any solution that you prefer. I use this solution called Canal Clean by Brasser USA that also contains some EDTA, lower concentration of EDTA with some surfactants as well as a disinfectant and a sanitizer. So here you can see we move down from the size 25 down to a 20, and the 20 is now at the apex. So we've used a couple of files here, and then we irrigate after each rhythm motion. The key here is to understand the concept of the rhythm motion, which is only 3 strokes. And you can see the debris is removed. Now I'm moving back up to the size 25, as I prefer for this case to be finished with the size 25. So do 2 rhythm motions there, and now that shape is baked in with the 25, so we irrigate that and remove all the debris. And at this point, clinically, we would go through our disinfection protocol and using sodium hypochlorite and various disinfectants that we may need, and agitate it using ultrasonics or whatever you prefer. And then we have a cone fit. And you can see how these new bioceramic BC coated cones that match the ESR fit so nicely to that shape, a match to the shape. And then now hydraulic condensation technique, which is a bioceramic based sealer based technique, is used to inject the sealer in the coronal half of the canal only, and then push it down to the apex with a file. That's the safest way of using this bioceramic technology. And then you coat your cone and you gently seat it, allowing the sealer to escape from around the cone, and then you seat it all the way to the apex. At this point, you would be searing it off at the level of the CEJ and condensing it down. And that is the essence, and basically that's the technique for the ESR. And I'm going to also show you a clinical case of this molar using the ESR.
Okay, the tooth in question here is a
mandibular first molar with the lithium disilicate crown and irreversible pulpitis. And what we do is we isolate the tooth with a rubber dam and use the DuraCut burr from the Real Dendo Axis kit to very quickly prepare an outline form through the lithium disilicate crown, and then move to the SaberCut burr to unroof the pulp chamber, cut the dentin, and get proper access to each canal. Here I'm using also the E15D ball tip ultrasonic tip to expand the access over each orifice, and we can see the mesiobuccal, mesiolingual, and distal canal, which is the 3 canals in this molar. The protocol for the ESR, using a size 10 hand file, and then we're going to be descending down, since this is a molar, from a 25 to a 20 and then possibly to a 15 in a crown down fashion using the rhythm motion, which is the recommended method for the ESR and reciprocation motion. We use the number 10 hand file to just kind of get some preliminary opening up to an estimated working length, and then added some canal clean. And now we're going to use the size 25 ESR file in rhythm motion, first in the distal canal, and then we move on to the mesiolingual canal. Still 3 light strokes to engagement, and then you back up and then use the endo swipe to clean the debris from the canal. It's very important to manage the debris in reciprocation. Removal of the debris from the file using the endo swipe or an alcohol gauze is very important. We did the mesiobuccal now. We're going to now remove any of the loose debris in the canal with an ultrasonic and then add canal clean. Instead of the ultrasonic, you could also use just regular irrigation with a needle. So now we move from a 25 to a 20. On the distal, we're very close to the estimated working length with a 20. On the mesiolingual, we still have a couple of millimeters left. And then another rhythm motion here on the mesiobuccal. And as you can see, these instruments' flexibility is also ideal for pre-bending a little bit so that you can gain access through a crown. So once again, every time we're changing files, what we need to do is we need to remove the loose debris and add canal clean to loosen it up. Now, after the 20, we move down to the ESR Scout, which is a much thinner file and allows us to now get, as you can see, to the estimated working length. Now that we've achieved estimated working length, we're going to get the final working length confirmed with the apex locator and a radiograph, and we can see that both in the distal and the mesial canals we have 21.5 millimeter of length in each of these canals. So we go on and once again add the canal clean, and now we set all the files to the final working length, and the goal is to incrementally move back up now from the size 15 to the final size that we want to reach to fit with our cones. Here we can see that the distal and the mesials finally reach the final working length with this 15. So we move up in size now to a size 20, and the 20 also very quickly reaches the working length. And we're just going to fast forward at this point and go a little bit quicker because the protocol remains the same. It's 1 or 2 rhythm motions followed by irrigation and the removal of the debris, and you can add hypochlorite at this point, and then proceed to make sure that the each file is reaching the length before you move up to the next size up. So the 20 did reach length in all 4, and now we're moving up to the 25, and the distal reaches a length very quickly. On the mesials, it does reach the length with a couple of rhythm motions. So I think at this point the mesials should be really fitted with a 25 as our final master file. However, on the distal, it was a little bit on a looser side, and the 25 reached the apex pretty easily, so we're just going to go up 1 size so that the distal would be a size 35. And you can see with 1 rhythm motion that reaches the apex too. And now we're going to do our full protocol for disinfection and removal of the debris and the smear layer, and we go on and fit the matching ESR BC cones. And it does show here that on the mesials, the mesiobuccal was reaching, or rather joining, the mesiolingual, which was it was a little bit challenging about that route. So we go on and add our BC sealer to the coronal half and use our files. You could even use one of the rotary files by hand to push the sealer all the way down to the full working length and individually seat each cone and sear it off
and remove the handle. Using a size 10 and 9 plugger, then we condense up coronally right at the orifice level. So we do that in each canal. Here, because the axis is pretty small, I needed to do each canal separately because there was not a whole lot of room if I had put two cones next to each other. And here you use the ultrasonic to remove any of the excess sealer that's on the canal walls, and very quickly now use this new product, the endosequence base, to fill the access, as you can see, very nicely and very quickly. And here is the full case. These 3-canaled mandibular molar. We have a couple of lateral canal that is popped. We have some interesting anatomy in the distal that are showing here at an angle how this canal was filled three-dimensionally using hydraulic condensation with the use of ESR instruments for the preparation.
Okay, so I think this case demonstrated that you don't really need to do a lot of hand instrumentation if you use this type of crown down motion using reciprocation and then trying to basically divvy up the cutting among a couple of different files, at least here. Now, this was a tough case. In anterior teeth, you'll end up using mostly. In easier cases, you end up using a couple of files. And in the tougher cases, you end up using 3 files. Of course, you may decide to have a different apical diameter in one canal, such as in this case, so I ended up using the 35 on top of that. But let's just get to the conclusion here, and basically to summarize what we learned today, whether you're using rotation or reciprocation, you can certainly have a really high success rate as long as you follow some of these basic principles of success. Now, of course, proper diagnosis, treatment planning, access, irrigation, disinfection, obturation, and obviously a proper restoration are all probably most important parts of success for you. But the instrumentation motion is also going to give you a choice in terms of the priorities that you have between efficiency and safety. And in my opinion, basically the crux of the issue comes down to this, that if you are really an experienced user and you do more than 100 root canals a year, which means more than 2 or 3 root canals per week, then you probably would benefit from the efficiency and the versatility that is offered by pure rotation. In that case, that the same protocol can apply to this endosequence blend protocol that we have, which didn't get a chance to talk about today due to a lack of time, but maybe in the future I could do another webinar on that topic for rotation. But for those of you who are probably doing less cases in a year, let's say 80 cases or 100 cases, we're talking about 2 root canals a week, then maybe for you guys the priority should be safety. And here, that's where the reciprocation, asymmetrical reciprocation, comes handy. But the goal here today was to show an alternative protocol and technique for using reciprocation in what I believe is to be a more responsible manner, which doesn't cause too much torque on the dentin, which could potentially cause microcracks, as has been shown in the literature, either on the dentinal walls and then putting too much torque on the wall of on the file itself as well, and potentially causing debris extrusion when you're not using a proper crown down technique. So just keep in mind that if you're doing reciprocation, you have to be a little bit more diligent about using irrigation and sharing the cutting burden between a few different files. And that's really, then you can successfully implement reciprocation motion. So it's with this spirit that we kind of designed this ESR protocol for use of reciprocation motion. It's designed to allow people who prefer reciprocation to utilize it in a responsible manner, meaning that if you're not causing unnecessary harm to the patient by excessively creating debris extrusion, causes post-op pain and torquing the dentin. And that's really why these instruments are designed the way they are. So with that, I want to thank you all for spending your past hour here with me, and please visit us on our website, rewildendo.com, for some future videos and demonstrations of this particular technique that I'm going to basically show more videos to just share some of the nuances of its use. And with that, I'd like to thank you and also get to some of the questions and answers that are probably here and I'd like to get to. So let me read the question, and then we'll go from there. So I guess here one question is, what is the endosequence base? Okay, so you caught that, huh? So the endosequence, Anna asked, what is endosequence base? Endosequence base is it's a new material that is going to be available soon over the next few months. And what that is actually a bioceramic that is dual cure. Been able to add a little bit of hydrophilic resin to the bioceramic that'll allow you to put that directly. It's a self-etching material, and it's got the bioceramic technology, so you can put that directly over the base and fill all the way up to the top in bulk and just zap cure the surface. And you know, that's how it's used. You can also use it directly over the putty, over the the regular nanoparticular bioceramic, and use it as a base or as a liner. So it's a really versatile material. It's not available yet, but it will be in a few months, and I will, if you follow us on the website, I will announce and get into the details of it. I'm actually very excited about that specific product it's going to be. Okay, Rick James says, if you use a file for a molar root canal, have you used them 3 times? Okay, so Rick is asking if how many times would I use the file. Again, Rick, to be honest, the manufacturer recommends using the files a single time, and that's the best way to do it, because remember, most of these files you never know when a file would separate. But I have found that if the barrier, now these instruments are less expensive than the Wave 1 Gold, and they're re-sterilizable. And that really is the key here, is that because I don't want people to get forced to use an instrument a single time, and then because of the price pressure, put the patient in a position where we're exposing the patient to more risk of not only just file separation, but also of cracking the dentin and pushing debris out apically. So that has been the goal. So I mean, you know, while the manufacturer says you got to use these one time, I usually have the idea that use, you know, a set of instruments, use them a couple of times is fine. That the cost is not that much, but using it, re-sterilizing it once is not going to be a serious problem if you didn't go through a very difficult molar. If you went to a really difficult molar, you're going to end up using 3 files. Might as well just toss them. There's no point in trying to be penny wise and pound foolish. So what tip did you use? Anna asked, what tip did I use for the BC sealer? I see that the tip was a curved angle. So that was, I think, it was the regular tip that comes in the syringe setup for the bioceramic sealer. But you could use a number of tips for the BC sealer. You could use even ultra-dense purple tip if you want to get a little bit further down. But again, the goal here is not to get really that far down. For the sake of safety, I really want people, if they're going to inject directly into the tooth, to only inject in the coronal half of the tooth, so that it doesn't get, you know, you don't run the risk of overfilling the canal. So Larry 40 asks, can you comment on XP3D files? XP3D files are excellent files. They can be used for finishing at the end here. Instead of using the ultrasonic, you could use the XP3D finisher to remove the debris instead of the ultrasonic, or you could use the ultrasonic. The XP3D shaper is also a great file that I use personally myself for retreatments and for very wide canals that I want to get kind of 3-dimensional shaping. The 3D files are kind of, the analogy I use it, they're kind of like a Formula One car. You really have to know how to use them to get the most out of them. So they're far more advanced for more advanced users, you know, specialists and so on. These rotation reciprocation motions seem to be a little bit simpler for people with less experience to implement. But if you use the XP3D files and you can use them and get the most out of them, they're great files, and they, you know, as I mentioned, I love them for especially retreatments, and where they can reach, the virtual core can reach areas that are far larger and wider than conventional files can do that. What RPM would you use these files at? You use them, basically you can use them in your Wave 1 handpiece. It uses exactly the same setup as Wave 1 Gold files, And the only difference really is the technique that you use them and the fact that these files are slightly smaller in diameter so that you don't have to core out the dentin as much for using an obturator. And instead you can use the hydraulic condensation, which in fact is a fraction of the cost of an obturator, and also the fact that you get bonding from it. So that's a great advantage. So, you know, it's 300 RPM, the same thing as the Wave 1 Go. 300 RPM with 150/30 reciprocation motion would work out just fine. So let me see what else. There's a lot of questions coming up here. Wondering if any advantage in using reciprocating file and pure rotation motion in some cases. Okay, Mark Lucas asks, is there any advantage in using reciprocating file in a pure rotation motion in some cases? Well, reciprocation motion, Mark, remember, is cutting on the reverse angle. So it's on a counterclockwise direction where the cutting takes place. So you can, you know, if you're going to use them in rotation, you better be having a handpiece that is cutting in reverse only, in counterclockwise direction. And you can do it, but it ends up being fairly aggressive cutting, so you just have to be careful and make sure that you have very light touch. Can be used to clean the file if no endo swipe are available. So Bruce asks, what other things can be used to clean the file if no endo swipe is available? You could use, I mean, traditionally people have always used the alcohol wipe. You know, the purpose of, you know, I designed to develop the endo swipe so that it's safer for the assistant to hold it and then do that, and also the fact that the instrument can be rotating while the endo swipe can be brushing against it and keeps it clean. But if you don't have the endo swipe available, just you know, just bring the handpiece to a halt and then wipe it with the alcohol gauze. You can also wipe it, brush it quickly against, if you have the endo ring, against the foam very quickly. But that does get a little disgusting after a while, the side of your foam. So, you know, whatever way it takes, just keep that file clean. That's the key thing to clean not the biofilm, but rather the removing the chip space, cleaning the chip space of the file consistently. And the analogy I use is, you know, just like when you're shaving, when people are shaving, you know, after you do a couple of strokes during shaving, what do you have to do? You have to clean the shaver, right? Because it stops cutting, because the chip space of the shaver ends up getting filled with hair particles, and that prevents any additional cutting. When you clean it, then it cuts better, and that's the same idea with our files. So we need to use our files as spoons, and we also have to use our files as shavers, I guess. What's next, the household item we're going to be using our files as? So let's see. Peridex irrigation in the canal. Hamos asks, do you recommend using Peridex in irrigating the canals? Of course, I would assume by Peridex you're talking about using 2% chlorhexidine. Remember, Peridex is 0.12. So 2% chlorhexidine has been shown to be good. It does work against E. faecalis. Unfortunately, that has been kind of going back and forth in the literature, its merits, whether it's absolutely necessary or not. But you could use it as an adjunct. You can't use it instead of sodium chloride because it doesn't have any tissue dissolution component that sodium chloride does have. Thank you. So that's nice. Why not start with a 20 file on the distal rather than a 10? Are you concerned with apical constriction? Fidel says, why not start with a size 20 instead of a 10? You can start with whatever file you judge to be, you know, adequate for the canal you're dealing with in terms of the diameter. I'm just using 10 as a, you know, as a basic thing that would apply to most molars. But thank you for the lecture. It's very nice of you guys are all being so kind. These questions are all being kind comments here. Let's see if we can get some questions in. Can you discuss what you mean about pre-tapping with ESR? Do you have to pre-tap? So, Anna, pre-tapping is a term used in carpentry, which means that you basically have to increase the diameter of a hole incrementally before you jam a big screw in there. And you do end up pre-tapping, you know, colloquially by just doing crown down and using multiple files. Anyway, I'm getting the signal here that I have to go off air. There's a whole bunch of other questions. I'm very sorry I wasn't able to answer all the questions given the time. I do recommend that you go to our website, realworldendo.com, and also in the Ask the Faculty Sections question of the forums. You can post your questions. I'd be more than happy to answer them, or on Facebook or on LinkedIn or any of those other venues. Thank you guys so much for being with me tonight. I look forward to spending more time over this year to discuss the different uses and techniques for best use of these set of instruments using reciprocation or rotation. Have a great evening.